update, and you probably want a little snack. If you want to do a snack, should we do a little clean plate? I'm giving a clean bowl for his food. Mr. Fluff is hanging out with teens again. Yeah, I know. Mm-hmm. All right. What we have here is a little man. Being adorable. Yeah, I'm talking about you. What? I will talk about you. Hi. Oh, what? Oh, you're so cute he is. Oh, yes, you're so cute. Adorable. Wait, do you want me to put you down? Do you want some snacks? Do you want some foods? Look at his little leg extension. Is it good? I like my food. Oh, who wants some food? Did you have a big day with Dr. Henderson? Oh, you just lay on your back and you eat like a little sea otter? Is that what we do? So, good, very good. Do you need to, here, to help you like this? Very good vet checkup. His stumps are looking very nice, starting to heal even. We got lab results back, the sensitivity results back for the bacterial culture, and the E. coli is resistant to the doxycycline and there are 2 antibiotics in Clavamox, and it is resistant to one of the 2. So basically, it's the second one is basically doing all the work here. So there's a brand new antibiotic that is safe for kittens that we're getting in tomorrow, that we're going to switch them to, that should be better. And so that sounds promising. There's good snacks for you. So tasty. Dr. Henderson wants to check out the wheelchair stuff. She's so great because she checks with a specialist about everything to make sure that there's, that everything we do is going to bring about the optimal result. So she's going to check about wheelchair and if there are any constraints or anything we should be aware of if we're using a wheelchair. Just to make sure that we're not, because we don't want to compensate for his legs because he does have use of his legs and we do want him to build muscle there. We just, while he's healing, need to let him be mobile without compromising his stumps. So, and then we don't know really what the future will hold for him. But I don't think long term wheelchair is going to be a permanent solution, but it's going to be a solution for now to help him get stronger and give him some mobility, because as you've seen, he does much better when he gets some frolicking and adventure time. Don't you? You must have your frolicking and adventure, because he is a 10-week-old kitten. He weighed 690 grams at the vet today. 690. Are you my pudgy little man? Very pudgy. The pudge is strong with this one, isn't it? Oh, do you want more? Okay. Um, so I've been letting him sort of dictate how much exercise he gets, and he definitely he lets me know when he wants it, and he lets me know when he's tired. He's very good about that. Did you just fall asleep? Did you just fall asleep? You just did a face plant. Oh, did I wake you up? Oh, aren't you so cute? Are you gonna groom? That would be nice. Very dirty. Oh, see, he started grooming. So, heart's good. Everything else is good. Dr. Henderson was very excited that his temperature was normal this morning. She said that's a very, very good sign. And it was normal again when they took it there, which is good, because I had been getting like a few higher temperatures, but then when we would go in, it would always be lower. So he's getting his temp up, and he's maintaining it in the normal range, which is really good, isn't it? Yes, very good. So she said, I'm trying to remember how exactly she put it. Definite signs of improvement, not out of the woods yet, but she is willing to let me say she is cautiously optimistic. So that's good. But not out of the woods yet, because with an infection like this, it can just suddenly spike for whatever reason, for any reason, and so that's kind of what we're concerned about. And if we can't, he is obviously fighting the infection, but we'll need to continue to do that, and hopefully these newer antibiotics will work even better. But there's no way to know until we try. But yeah, so that's kind of still the biggest hurdle is the potential for infection. Oh, he's so cute. And E. coli, unfortunately, as a bacteria, is known to mutate and to develop resistance very quickly. So we just have to continue to monitor very carefully. Yes, no more poop in your stumps, okay? Yeah, so I will definitely talk to Dr. Ferguson when she gets back about flour. It's not safe. They've tested it and declared it safe in kittens as young as 6 weeks. So Clavamox is really the only thing that can be used safely at this age for flower and bluebell. But they will be 6 weeks, if you can believe it, this week, I think, if that's possible. And so potentially it may be an option. So um, I'll have to compare the lab results because I don't know if this E. coli has the same resistance as the other. Um, so we'll have to figure that out. But look at you. Oh, what a wondrous creature. He's all tuckered out for now, for the next 5 minutes. Oh, very sleepy. There was not any pus in the stumps. Nope. So, and she could see that the skin is actually starting to heal down there, which is kind of amazing because it was just necrotic tissue it wasn't holding staples. It was like dead tissue down there, and now it's actually healing, which is kind of amazing. And uh, there is some drainage, but it's kind of like clear bloody-ish discharge. It's not like the like massive pus that was there, which is amazing considering the it's resistant to the doxy, so we're not doing that anymore. And then one of the two elements of the clavamox, it's resistant to. It's just because he's just so strong. He definitely is a medical marvel. Definitely 100% medical marvel. Yes, he is. Mm-hmm. So, Dr. Henderson's getting information from specialists about anything we should be aware of using a wheelchair. We talked a little bit about doing physical therapy on his stumps to start building muscles. We're a little bit early for that yet, but you can see, I think, well, maybe you can't see from that angle. You can see he has good, maybe his tail. He moves his little stumps. He bends his knees. When I'm walking him around in his little harness sling, he kind of paddles his back legs when he's trying to turn and stuff. So, what's this? So he does have movement there, and so all in all. Oh, and probably the most exciting thing for him is that she said I could give him a bigger area so that he does start moving around a little more. But I just have to make sure that it's all padded so that he's not walking on hard surfaces. So, because we were concerned about bandages coming off, and they probably will come off, but it is starting to close up and heal up. And so, as long as I can keep the bandages on him as much as possible, like I may still put him in the small area overnight just to try to not have his bandages come off while I'm sleeping rather, or while I'm watching him from bed, more accurately. So we'll just have to continue to play it by ear. But I think it was all in all. I don't think he could be making any better progress. And now he needs to sleep. He had a big morning and a big afternoon. The staples are still there. There's still a lot of healing that needs to happen down there, and he's nowhere near healed. It's just that they can see it's starting to heal down there. The skin actually staying closed, starting to grow back together, which is what we want, like a nice tissue closure at the end of the bones. So, and the fact that the staples have actually held in the one where the bone kept popping out, um, that's very good. So that's the one that we're most concerned about because this one has a good amount of skin at the end of it. So, but this one had the worst infection, but the most skin. This one had like the skin and the bone were kind of even, which is why the bone kept popping out. But this one wasn't as infected, probably because the bone was popping out and like allowing things to drain. It's pretty horrific though, wasn't it, buddy? It's much better now. Yes. Look how cute he is. Look at my little medical miracle. He's so adorable. So, encouraging litter box use, encouraging a little more independence. That's kind of what we've kind of reached that phase now, where I will make him a bigger corner and set him up with a separate bed and litter box that's very accessible and food and water, and hope that he will start drinking some water. He hasn't really needed to because I've been keeping him very hydrated, but what we hope is that he will start going to the bathroom in the litter box, not just wherever he's sleeping, which I think he's quite capable of. But we'll see. I'm sure it will take him some time to figure out. Right, Mr. Buddy? He's so handsome. So I think that's good. I'm feeling cautiously optimistic too. I don't know the cost. I will let you know when I find out how much the little wheelchair will cost. And we also had a group of students from Walnut Grove Secondary School who would like to design one for their 3D printer, which would be pretty cool. So, and that's one that they can just make, they can scale and make bigger as he grows. Um, because he may end up having a combination of things as he gets bigger. He may have prosthetics that and he may have, a wheelchair sometimes, and I don't know. I have no idea how that all works and what's going to happen. Or he may be fine with nothing. He may be fine. Lots of them are fine on their own. But I just don't know about his little stumps. Don't have a lot of padding there, so it may not be comfortable for him to walk on them. I suspect that's why he was lifting his bum up at the beginning. Oh, like do you like that? You like a belly rub? Yeah, belly rubs are good. So we'll just have to see. No way to predict what's going to be the best option for him. Implants, prosthetics, nothing, wheelchair, combination. Don't know. But definitely we are exploring all of those options. And whatever ends up being the best option for him is what we will try to make happen. We will, because he, of course, deserves the best. He's had all of his bad times already. Hopefully he's gotten all those out of the way and now he deserves like a lifetime of awesomeness. Right, buddy? I can't imagine how horrible the first 9 weeks were. But he still wanted to live so badly, despite being in pain all the time and infected, and he can't keep up with everyone else, and he can't find food, and he's different than everyone else. Topper pounces on him all the time. But despite all that, he really, really wants to live. So he's got a full tummy, he's content, he's got his pain managed, his feet, well, where his feet were must be feeling much, much better. So I think all in all, things are looking up for the little guy. But Dr. Henderson is still making me say that he's not out of the woods yet because of the infection. So not out of the woods yet, but cautiously optimistic. So Dr. Ferguson has been out of the office for a couple of days. That's why we've been seeing Dr. Henderson, who's wonderful, also obviously. So I presume they will both continue to consult with each other, and we'll probably see them both. Oh, so sleepy. We're very, very lucky to have such good vet care because this is not a case that vets would see maybe never even in their lifetime. He's so unusual because you see older cats with injuries like this occasionally. It's rarely both legs, and when they're a kitten and you're so limited in what you can treat them with, and they're so tiny and weak and fragile, it's very challenging. So very lucky to have such good medical care for him, and also that the emergency room team was able to keep him alive that first night. That's uh, that's amazing too. So we're very lucky to have good medical care. But I can't. I have to keep petting him because he's so cute. So I'm gonna have to build him his little area. Oh, Luana is gonna be over on the other side with the kittens the next couple of days. That'll be so fun. And Lori and Dawn, they're gonna have lots of friends over there. Oh, look at you. Um, is Cassidy a feral kitten or is he a feral bunny? You decide. Oops, let's go this way. Feral kitten or feral bunny? Or Batman? Is he Batman? He's very handsome. I can't wait for him to try out his. Ooh, ooh, ooh. Look, he didn't even. He's so sleepy. He's had such a big day. So tomorrow we'll go get more meds. Ooh.